Hi everyone, I hope you all are doing well. Today we're going to be talking about the high note study. The full title for the study is High Sensitivity Near Patient Cardiac Troponin, and the PI for the study is Dr. Lisa Mills. So let's start by going over the background of the study. The main condition in question for the study is myocardial infarction, or MI. Myo refers to muscle, cardio means heart, and infarction refers to the death of tissue due to lack of blood flow. So we can put this all together to get an idea as to what an MI is, which is a heart attack caused by the irreversible death of heart muscle. In this case, it's due to a lack of oxygen caused by blockage. And the blockage that we're going to be talking about is plaque, which is the accumulation of fat, cholesterol, and other substances. So let's go over a little bit as to how exactly an MI occurs. So it starts by a plaque forming in the artery, which you can see in the image on the right. And again, as you can see in the image, it ends up leading to a reduction in blood flow through the artery that leads to the heart. This can end up causing the heart muscle that the artery leads to weaken, as it's not receiving the blood that it should, and therefore it's also not receiving the oxygen that it should. Eventually, the plaque can end up rupturing, which can lead to a blood clot forming. The blood clot can end up completely blocking the artery, which prevents blood from flowing to the heart muscle. This ends up depriving the heart muscle of oxygen, which means that it's also ends up depriving the heart muscle of blood, which means that's also deprived of oxygen. As the muscle cannot survive without there being oxygen, it ends up dying completely. This ends up leading to an MI or heart attack occurring. Now let's talk a bit about troponin. Troponin is a protein that's found in heart muscle fibers. If the heart muscle is ever injured in some way, then the troponin can be released into the bloodstream. So that's why we have the troponin lab test, which measure the amount of troponin that's found in the blood. And this can end up indicating whether the patient has an injury, a heart-related injury or not. Something that's cool about the troponin test is that the amount of troponin in the blood can end up correlating with the severity of the heart injury. So for example, if the patient has a slight heart injury, then the troponin levels are going to be relatively low compared to a patient with a severely injured heart muscle. So the current test used to measure the troponin levels is called the Soc Troponin Test, and it measures the amount of troponin T or troponin I proteins in the blood. And you can see in the image on the bottom as to how it looks like with the troponin bound to the heart muscle. So one of the disadvantages of this test is that the blood sample has to first be transported to the lab, which can end up taking some time. Additionally, the machine used runs in batches, which means that it can take some time for the results to be available. Overall, this means that it can take a while to understand whether a patient could have an MI or not, meaning that treatment can be delayed. This causes there to be a bit of a desire for more efficient ways to measure troponin levels. This leads to what we're looking at in the high note study. So a company called Quiddle designed a test that measures the amount of troponin I in the blood using either whole blood or plasma samples. So this already helps save a little bit of time because usually you need to filter out the plasma from the blood for troponin test to end up occurring. So in this case, you can just use whole blood, which ends up saving up a lot of time. Also, it mentions in the description for the test that the sample has to be anticoagulated. So this means that the sample is not going to clot. The blood sample isn't going to clot during the test. Overall, this device is both more sensitive and faster than prior tests. Results can be given within 20 minutes, which is very quick. The quick results end up meaning that there can be a quick diagnosis and a quick initiation of treatment, or a quick rule out if the patient doesn't have MI. It also means that it's easier to determine the amount of change the troponin levels may be undergoing over time, which can allow the medical team treating the patient to understand whether the injury in the heart is getting worse, and if so, to what extent. These factors combined can lead to greater efficiency in the ED, as patients who need to be treated can be treated right away, and patients who do not have MI or any other condition can quickly be allowed to return home, which can help reduce overcrowding in the ED. Alright, now let's talk a little bit about how the test itself works. So it uses a technique called fluorescence immunoassay, and this technique works by using antibodies that are artificially made with a fluorescent molecule attached. These antibodies work by basically lighting up when bound to the target molecule due to the fluorescence. The target molecule the antibodies bind to is known as the analyte. So what essentially happens is that the antibodies are placed in a beaker followed by a solution with an unknown amount of the target molecule or analyte. These antibodies will emit light at a certain wavelength when bound to the analyte, and the amount of light emitted can be used to determine the amount of analyte in the solution. So for example, if a relatively large amount of light is emitted, then that can indicate that there is a relatively large amount of analyte in the solution as well. In the case of the triage-true test, the troponin is the analyte, and we are attempting to determine the amount of troponin present in a blood sample obtained from the patient to help either diagnose or rule out MI. Alright, so now looking at the triage-true test. A few drops of the patient's blood will be added to the sample port of the test device, which is shown on the right, and is a component of the overall triage-true test. The troponin in the blood sample will react with antibodies, leading to the formation of the antibody-troponin conjugate. The conjugate will flow through the device through capillary action and will be captured in a discrete zone meant specifically for the troponin I conjugate. The test device will then be inserted into the triage meter pro device, which you can see on the right, and it will analyze the sample contained in the test device by comparing the fluorescence in the troponin I conjugate zone to a control zone, which is also contained in the test device. So the meter pro will use this to determine the amount of troponin I in the sample and thus the patient's troponin I levels. And as mentioned earlier, the results can be determined within 20 minutes of the blood sample first being inserted in the test device, and the results will be stored in the device's memory, which is something that can be useful in the ED in regards to being able to easily recall different patients' results. Alright, now that we've gone over the study's background along with how the triage-true test works, let's talk about the study itself. The purpose of the high note study is to validate the clinical performance of the triage-true test in helping diagnose MI and in rapidly ruling it out. The inclusion criteria for the study is that the patient should be 21 years or older, and the subject must present in the ED with signs and symptoms of MI. And something to note is that we are only enrolling English-speaking patients for the study. The exclusion criteria for the study is that the subject or the patient is either unwilling or unable to comply with the study procedures, or they are unable to provide informed consent. Alright, now let's talk about screening and enrolling patients for the study. The main chief complaint that we want to, or like the main thing in general we want to keep an eye out for is chest pain as a CC. One of the reasons for this is that we want to enroll the patient into the study before they have their first blood sample taken for the troponin T test. So we're ideally wanting to look for a patient that could potentially have a troponin test ordered, so that we can keep an eye on them once they finally have that troponin test ordered. So that's why we're going to be screening mainly by looking for chest pain. Chest pain isn't the only chief complaint. It can be anything heart related, such as shortness of breath, leg edema, but chest pain is the main one that we are going to keep an eye out for. And of course, we're also going to be screening for the troponin T lab being ordered. Something to note is that we can also screen for patients using ED-LOS. Basically, if a patient is roomed quickly and they have a short ED-LOS, then maybe there's a higher suspicion of them having an MI. So we want to keep an eye on those patients, as a troponin test will probably be ordered soon if it hadn't already at that point. Also, patients who have not been roomed yet may also have a troponin lab ordered. So we also want to make sure we screen for patients in intake and stack, because these are patients who are, in the waiting room or just haven't been roomed yet, but they may still be receiving some sort of treatment. Something to note is that none of the inclusion or exclusion criteria or screening is done using information inside of the patient's chart. So that means that we shouldn't have to click in. So therefore, although the study does have an IRB number, we won't be clicking into the patient's chart. Also, this is an RC study, so only the RC and JS can obtain consent and enroll patients for the study. So something to keep in mind is that the study is a very time-sensitive one. The blood sample needed for the triage-true test has to be collected when the patient's first blood sample is being collected for the troponin T test. So that means that as soon as the lab has been ordered, but before the blood's being drawn, the RCGS is going to try to consent the patient so that a sample for the triage-true test can be collected with the sample for the troponin test. So for this to happen, we have to keep an eye on the patients that we suspect may have a troponin test ordered, so that we can actually start enrolling them when it's finally been ordered. Also, samples will be collected at periodic time intervals in order to note the test's sensitivity and noticing changes. So there are going to be several samples collected over this time period. So that means that the study can take a while to finish for each individual patient. So the RC and JSs will only enroll a few high node patients in a day. And they will stop enrolling patients at 4 p.m. because it does take several hours to finish collecting all the blood samples, and the last shift ends at 11 p.m. So we want to make sure that we're done by then. So basically, something that you can use all this information for is that when you get on a shift, you are going to want to talk to the RC or JS and ask, whether we are currently enrolling any high node patients. And if the RCJS say that they are still, enrolling high node patients for the day, then make sure that when you sign into EMR, that's one of the first things you want to screen for, because it is very time sensitive, and we do want to make sure we get to the patient before their first blood sample is being collected. So that's it for high note. There are some links that I'll include in the description, with some more information on myocardial infarction, along with some more information about how the Triage 2 test device works. If you have any questions, feel free to contact the head trainer or senior trainers. And yeah, that's it for now. I hope you have an awesome day.